So, Catherine, she's one of my work colleagues. She is coming to talk about birth trauma, and I'm just going to wait for her to join, and then she can tell you a little bit more about it. But basically, I feel quite passionate about this subject because there is no definition for birth trauma. It is just very individual and can affect anybody. So, she'll be here in just a second. Lots of waves. Hello. Right. Catherine has joined. Let's find Catherine. Okay. Wait for the connection.
Hello.
Hiya.
How are you doing?
I'm okay. I'm just about functioning.
You must be exhausted.
I'm okay at the minute. I think I'm just purely running on caffeine at the moment. So
Yeah.
I'm sure I'll crash at some point. Probably straight after this video, and I'll just go and lay down and zonk.
Hopefully you got some time to rest now, have you?
Yes, I'm back in tomorrow, but yeah, for the rest of the day I'm fine. I've got no other plans, so I can have a little bit of sleep. My video earlier, I've got no idea what I'm talking about. I've not slept. I had no sleep since 11 o'clock yesterday. So.
Oh, goodness. Oh, well, thank you for having me on today anyway. It's really great to be here.
Thank you for coming. I'm so pleased that you agreed to come on and talk, because I know you've not done a live yet, have you?
No, I haven't. No, I've done a YouTube video at the beginning of lockdown, and I was asked to do a video for Michelle Quashie for the Birth Gems 2020 series that she did, just to give women some information, because obviously it was, very beginning, it was such an uncertain time. I mean, it's still an uncertain time, but, things are kind of slowly getting back to normal slowly, aren't we? Yeah.
Brilliant. Okay, so, Catherine, introduce yourself and tell people what it is that you do.
Yeah. So I'll tell you a little bit about myself first. I'm Catherine. I've got 3 grown-up children, and I lived in Essex all my life. And one of my most favourite places in the world is right here in Essex, and that's Torquay Beach. And I love it down there because it's where I spent a lot of time as a child, and with my mum, and also with my own children as well. So it's a really special place. So big up the Essex. But I've been a midwife for about 15 years now, and midwifery's been an absolute huge passion of mine for a long time now. I've been an NHS midwife, a private midwife. I've been a community midwife, a hospital midwife, practice development midwife, as well as I've also been a consultant midwife as well. So done that for quite a long time. But my passion these days is for helping women and sometimes their partners to resolve their birth trauma, so that they can move on and go back to how they felt before they had the birth trauma effectively, so they can enjoy their lives fully again.
Vast wealth of experience.
Yeah. I mean, it's been an interesting time. And part of the reason why I'm sort of semi-retired now as well from midwifery is because, I did suffer a bit of burnout myself for a while. So I just do part-time hours now, and it helps me just keep my skills and my knowledge up to date about what's happening in the midwifery world, so that I can help women that I care for, really. I think it's really important, and, get an idea of how maternity services are changing, and, what else we need to do to keep changing them, and make sure that women are seen and heard in the maternity services.
And you work across a few different sites as well, don't you? So you must get that comparison of each way that different hospitals work and and sort of take like the best of each and compare and take that away with you as well.
Absolutely, and I think there's different kind of so it's probably different cultures at on different sites. Therefore, and I think the kind of the common theme across both sites is the care is incredibly obstetric led. And I think that's a common feature across most hospitals in the UK. And that brings with it its own problems, doesn't it?
Yeah, definitely. I mean, obviously I work with you in one of the trusts that you work at, and I've had both my children in one of the other trusts that you work at. So I've kind of got experience of it from both sides of the coin, which any midwife with their children has as well. But the reason I wanted to get you here today to talk is because birth trauma is just such a massive topic, isn't it? I mean, how common is it?
So, I mean, this is quite shocking for me, really, but we're looking at around 30,000 women every year in the UK are affected by some kind of birth trauma. I mean, that just shocks me, and I just think that's a totally unacceptable number. I mean, any woman being affected by birth trauma is unacceptable, but 30,000 women, and that doesn't include the women that experience trauma as a result of pregnancy loss or as a part of their breastfeeding journeys. I mean, there's a lot of women being traumatised in that time as well, and I think. It makes me very sad that all these women are starting their parenting journeys in this way, and I think that's partly why the birth trauma resolution has sort of become my new mission in life and my new passion now to really help those women to find their feet again, really.
Sorry, my Wi-Fi is shocking. Okay, yeah, sorry. I was just saying, I mean, like, obviously it affects women, but who does it affect the most?
So I think, it's a complex thing, how it's caused, but I think, we all approach birth in different ways, and every woman's experience is unique. But we all kind of know that birth is, it's a huge life-changing event. So there's a lot of hopes and emotional investment before you even get into the birth room, really. We think about what it's going to be like, what our baby's going to be like. And I think a lot of birth trauma can be caused by serious emergency situations happening during labour and birth. But I think the thing that's one of the saddest things for me is that I think, as you and I both know, is that abuse or get from it, they've got a healthy baby, and that's all that matters. But women are not being heard. Trauma is real, and women's birth trauma is being minimised and normalised by people saying that all that matters is a healthy baby, and that's not all that matters at all. Women and their babies and their birth experiences matter too, because all of our experiences are valid and formative and go on to affect us throughout our lives. So, I think the fact that women aren't being heard is really, it's really painful, and I think we need to get more women to make sure that systems change. Yeah, totally. Like minimising that trauma with that, and people say it with the best intentions. Like on the chat that I did just now with Pip about baby loss, people say these things with the best intentions, but it's just not helpful, and it really minimises and belittles exactly what it is that you've been through, and it makes you feel like maybe it's my fault then. Maybe it's not that bad. Maybe I'm overreacting, and
and then that's a whole other psychological effect.
But I think absolutely, but I think the other side of it is as well that it can make women feel that society view us just as baby making machines, and actually, so long as we're contributing to continuing to populate the world, what actually happens to us during that process doesn't matter. But of course it does matter, because how we feel about our births, makes how we feel about ourselves as people, and how we go on to have relationships with other people as well.
Yeah, and I mean it can happen to anybody. It can happen to any woman who walks, even at home, home birth, hospital birth. It can happen literally to anybody. And I think it's not always what is done to us, but it's also the words that are used in the scenario as well, because words have
absolutely
impact on any kind of physical trauma as well. I've done a video back in May, I think it was, talking to my sister, who's you know as well, who's a doula, and we talked about the effects of birth when you're a survivor of sexual abuse.
Yeah.
And someone who's been through sexual abuse and then gone on to have a birth that was traumatic, there's a whole lot of triggers that can happen in that scenario, and it's not always what's happening to you. Sometimes it is the words, and I know for me, and I can speak from, I've spoken about it on here, I'm not shy about my experiences, but for me it was sitting on the table in theatre when the anaesthetist was prepping me for a cesarean and said, well, if you just sit still it won't hurt. And it was those words, and that trigger just went, it was that thing that stood out. And, and I went through an emergency cesarean, and all of that paled into insignificance with just those few words that were said at that time.
Absolutely. Yeah. I mean, it just can be how you talk to can make such a huge difference. It really does.
Yeah.
Really can.
So, what can we do to prevent this happening?
Well, I think we need the system to change, and I think we need it for it to be more respectful. I think women's voices, as I said already, women's voices need to be heard more. I think the continuity of care models are really helpful, because you can have that relationship-based midwifery care, and midwives, what we're trained to do, what we aim to be, what we aspire to be, is true advocates for women that we're caring for. But sadly, so often the system that we work in doesn't really facilitate us working in that way. But I think these continuity of care models from the Better Births, the initiative, the Better Births Initiative, I think these can really work, and it's really, really heartening to see that they're being pushed out there already. They've been planned for ages, but because of coronavirus, those plans were set back. But they're being pushed through again now, and the teams are sort of building up again. So I think for a woman, having a midwife or an advocate with her who she knows and trusts, really good way of helping prevent the trauma. Trust them, less likely that you'll be traumatised. I think and women's bodies, and how amazing our bodies are, and how powerful we can be. And I think we often we hear that it's the patriarchy that's trying starting to be heard. We've had the EU report this week about the different medical investigations with the mesh, but also we've got very strong.
Sorry, my Wi-Fi keeps cutting out. I don't know if it's me that's losing everybody or if everybody's losing. I don't know, but sorry, carry on. I missed the last couple of minutes of what you said just entirely, but carry on. Sorry.
I was just saying about voices need to be heard, and I think we have some really strong maternity voices partnerships now that are rebuilding under the new model. You know, they were previously the MSLCs, but I think they're building up again. But there's also a really fantastic movement over on Facebook, which, as they said to me, and there's also the White Ribbon Alliance, which are, you know, organisations promoting safer motherhood. And I think we need to keep supporting these organisations that are working towards helping to prevent the kind of disrespect and abuse that causes a lot of the birth trauma.
Yeah. I feel passionately about the whole continuity of care. That's what I'm doing at the moment. And you know, as you said a minute ago about how that can have such a positive impact. One of the women that I've looked after who stands the most to me when I did her appointment, you know, I've always in that time to talk element at the beginning of the first midwife appointment where you're just chatting about everything that, you know, might be something significant in their pregnancy. And, you know, when I talk about, you know, history of any kind of trauma or abuse or, you know, anything that's going to have a significant impact on this pregnancy journey. And this particular girl, she broke down in tears and, you know, a whole ream of history came out. And the fact that, you know, she then saw me all the way through her pregnancy, she got to meet all of the team. And for what could have been quite a traumatic experience for her, because, you know, it ended up being that she had gestational diabetes, she was induced and, you know, resulted with a cesarean section. And what could have been in that cascade of events quite a traumatic experience for her, she found it to be quite positive. And she found it to be quite positive because of the support that she'd had the whole way through.
Yeah.
And the fact that midwives with her throughout that whole labour journey that she trusted and she had a voice for her, you know, and I think that had such a huge impact. And she'll, you know, she would come on here now and say, you know, this is exactly how I feel. She told me time and time again that that's the positive impact that it's had. And I think that that's a massive part of reducing this trauma that women experience just by having a trusted advocate with them who they know haven't got to repeat their history about. They haven't got to repeatedly say, you know, I don't like being called XYZ. I don't like having my hand held. I don't like having, you know, just those little things that can be triggers for people, which you don't, you know, you wouldn't know about somebody unless you had that frank conversation with them. So I'm such an advocate of continuity of care for those reasons.
Yeah, me too. I think it's amazing. Yeah. I think it's so beneficial.
Totally. So what would be symptoms of birth trauma? What are symptoms that you would note?
So what happens when we have a traumatic experience is that our bodies or our brains trigger a fight or flight response, which is a normal healthy response to any sort of threat to us. And obviously, if a woman is faced with what she believes is a threat to her or her baby's life or health, then that's going to trigger. But of course, you can't fight or fly when you're in a hospital birthing situation. You're not trapped because we don't hold people prisoner, but you know, it's a very different situation. So what then can happen is that our brain's going to kind of get stuck in that fight or flight response. And so when we have flashbacks or something might trigger us thinking about our own birth experience and take us a moment. And so we experience the physical symptoms again. So anxiety, flashbacks, as I've said, emotional overwhelm. A lot of people suffer with hypervigilance, where they're constantly monitoring everything that's going around them, so they can't really focus on anything outside of the area. Sleep disturbances are very common. The difficulties as well are often kind of, again, that's something that's raised. It's just, you know, relationships with partners, even with the baby sometimes, but with in-laws, with healthcare professionals, you know, issues with trust around that can be quite difficult. Some women and their partners would love to go on and have another baby, but for whatever reason, or because of the birth trauma, they're just too afraid to get pregnant or even think about giving birth again. And being able to work with women in that way to help them, overcome this trauma is brilliant. I love it. It's just a fabulous thing to be able to help people to move through that.
Yeah. Very. So what is it that you offer to help to resolve?
Well, so there's lots of different things out there, and sometimes we find that a birth debrief with a private midwife or even at the hospital can help to go through your notes and discuss what happened. But sometimes the effects are a bit more sort of long-lasting, and people need a little bit more help to lift the symptoms of trauma. So there's many people who are living with trauma and using kind of mindfulness techniques and meditation and other self-care practices to get them through sort of the everyday. But this can be quite exhausting, and often it's quite ineffective in the long term, and it doesn't get rid of those symptoms in the long term. So I use a brilliant technique called the 3-step rewind for birth trauma resolution, which helps women and their partners to lift or kind of like unhook the negative and limiting emotions from the birth experience. So it doesn't take away the birth memory, but what it does is it means that they can remember the situation, but without feeling those horrible, those emotions, those negative emotions.
Okay. And like, what is it? What is 3-step rewind? What's the theory behind it?
So, despite its very long name, the 3-step rewind for traumatic birth resolution, and in fact it works for any trauma, not necessarily birth trauma, any traumas. It's a very simple but powerful technique. And one of the great things that I love about it is that it can be carried out without having to put the traumatised person into distress. The memories are accessed in a safe way to avoid re-traumatisation. And it takes just a few hours to complete. And the effects are immediate, they're long-lasting, and they're permanent. And sometimes just, wow. I mean, sometimes the results just blow me away as well.
Okay. And how do women feel afterwards? Is there like an immediate
noticeable? Absolutely. I mean, the feedback from clients is absolutely fantastic, and it's literally life-changing for some people. Immediately after the rewind, women often say they feel lighter or relieved. After the first session, they're left in a state of relaxation. We do a relaxation at the end to make sure that they're comfortable and not going away. That nothing has been brought up, because obviously there's a potential when you're revisiting something that it could make you feel a bit upset. But we just make sure they're calm. But the positive effects continue to grow over the next few weeks as well, and they're permanent. And that's why I love this. I mean, I love to hear how people are feeling when I catch up with them a couple of weeks after their rewind, because they're usually so full of hope and positivity. And I can just tell you a quick story. I worked with this woman, Emma, and she came to me and she'd had a traumatic experience about 15 years ago. Her traumatic experience was, and she had become. Since this experience, she suffered a lot with anxiety, and her anxiety meant that she was quite hypervigilant around her children. She didn't want anybody else to look after her children, but she also had found that since this traumatic experience, that she was unable to drive on motorways or dual carriageways. Now, she had a job that meant she had to visit people in their houses, so she had to drive nearly every day. So she either had to put herself into an anxious state while she was driving to go on these roads, or she spent hours planning different routes so she didn't have to go on dual carriageways. And anyway, I spoke to her recently, and I worked with her about 2 or 3 years ago now, and I spoke to her recently again, and it has changed her life, because she doesn't even have to think about it anymore. She lets her girls go not with anybody, obviously, but, she's comfortable letting her girls go to her mother-in-laws and, that sort of thing. He doesn't constantly fret about them all the time. So, I mean, it's just to get feedback like that is just amazing, and it's why I love doing this, because it's just, who wants to live their life in that sort of state of anxiety?
Being a prisoner of anxiety is exactly how it is.
Yeah.
I have had rewind treatment myself, and I know that once you've learned that technique yourself, you can practice it at home and you can go through it.
Yeah, because I mean, our minds are such powerful tools as well. Yes, it's kind of, it's not our minds tricking us, but it's our minds that are trying to protect us, which kind of puts us in that situation where we're experiencing these feelings. They're just kind of a bit misplaced. So,
learning about it.
Yeah, we can just use that same power of our brains just to change that back again, so that we can feel comfortable. And obviously, we still want the fight or flight to trigger when it's appropriate, and it doesn't stop that happening.
Yeah. Is it like hypnotism?
Is it like hypnotism? No, it's not like hypnotism. I'm not a hypnotist. I am a qualified hypnobirthing practitioner, and there are elements which are similar to hypnotism in it, but it's an actual process. It originated from NLP, neuro-linguistic programming, and it's what's known as a dissociation technique, which is a bit different to hypnotism. I think with hypnotism you often have to do several sessions to get the benefit. I know I've used hypnotism type techniques for weight loss, and it's quite handy. If you continuously listen to the hypnosis every night at bedtime or whatever, it starts to help you change your habits. But this is just it's a 3-step rewind, but the 3 steps are the different levels of dissociation. It's actually done in usually 2 face-to-face or Zoom sessions, and then a follow-up a couple of weeks later. I mean, the 2 first sessions, if someone is desperate, it can be done in one go, but it just needs a little bit of work in the middle from me, just to work out what the key positive outcomes are that the person wants from the session. So,
yeah. I mean, I personally have found it very, very, very beneficial, and like I say, once you've learned that technique of going through the process, you can literally sit and do it yourself, and as long as you're in a safe environment, it is extremely beneficial to use for lots of different aspects of your life. Even you can sit and go through and do the process yourself. But what do people do to resolve their trauma symptoms? If they've come to you initially and they have all of these symptoms that they've been trying to work with, and then they're coming to you for that treatment, what can they do to help in the meantime?
I mean, obviously, as I've said, what people can do in the meantime is you can manage the symptoms. I mean, there are lots of people out there living and managing symptoms of anxiety and overwhelm all the time. And sometimes those things can help, but they can help reduce the symptoms, but on the whole, they're not going to remove those symptoms. So I think if somebody's got to the stage where they just think, I just want to get rid of these symptoms now, then that's when they can come to me or somebody doing similar work, and I offer a free consultation to see if they want the rewind and I'm a good fit for them and what they're hoping to achieve, because it doesn't work for it won't necessarily be right for everybody. And I think some people will perhaps get more benefit from perhaps something like CBT. But I know from my own experience, I didn't find CBT very useful at all, and I don't think it helped me feel heard in my situation. And I think feeling heard is such an important thing. The thing that struck me with CBT was it was very much one size fits all, and just do these exercises, and you'll think differently, and that's not really shifting anything that's sort of there, sort of deep inside, is it? Does that make sense?
More of a coping technique. It is more of a coping mechanism rather than resolving something.
Yeah, I think so. Yes.
Okay, perfect. Let me just see if there's any other question.
I think it would be fantastic if, you know, we could change the system and if birth trauma could become a thing of the past. I think that would be brilliant. But I think until it does, you know, I'm just going to have to keep doing what I'm doing. And
absolutely. So, I mean, people can find you, can't they, on Instagram at Catherine _
yeah.
And if anybody kind of got anything that they're worried about coming on and asking right now, they can message you directly, can't they? I'm going to put this up with a link to your page as well, so people can come to you directly for advice or tips, or if they've got something they want to address with you, and they can speak to you, can't they?
Of course they can. Yes, I regularly have women DMing me with their issues, and you know, there's a certain amount of advice I can give out over DMs. But obviously, having a chat with somebody is also really useful to find out, you know, sort of the root cause of their problem. And I think, you know, sometimes understanding the root cause and knowing that you can deal with the root cause of your symptoms is a relief in itself, you know.
Yeah, I think particularly if, I mean, I know in lots of cases where, you know, people have done the whole, you know, having a debrief session at the hospital and going through their notes, and they've talked through the birth process, and that helps to an extent. It helps to understand what has happened, but it doesn't help you deal with what's happened. So if you've gone down that route already, but it hasn't resolved anything, then this might be the natural next step for that person, and that would be at which point they can contact you and say, well, I've done this and I've not actually found the benefit and the actual solution that I'm looking for.
Yeah, absolutely. And you know, as I say, it's not the right fit for everybody, but I'm very happy to talk to people and let them know whether I think I can help them or not. I think, you know, that's really important. And obviously the debrief side of things is, you know, can be really helpful for someone that's had a trauma from an emergency situation, because as you say, it gives them an understanding of what happened and why and how, because obviously we don't all know everything about birth and emergency situations, thankfully. But I think what the debrief probably can't help with is when somebody feels that they weren't heard in the birth room, or they were, you know, they weren't talked to very nicely, or, you know, that kind of side of things, when they felt they were treated badly, or they were treated badly. So.
Yeah, definitely, absolutely. Because like I say, it's not always what has happened to you. It can be words that have been used, and they leave a mark. You know, they leave a definite deep scar there.
Yeah.
That you're addressing.
It's very painful.
Yeah. Well, thank you, Catherine, for coming on and talking and sharing your knowledge.
It's
very grateful.
I'm very grateful that you invited me. Thank you.
So I'll pop your Instagram on so that people can get in contact with you.
Lovely. And if anybody out there listening does need any quick help with anxiety symptoms for now, if you pop the link in my bio, the top link on the link tree is some resources for some breathing exercises and some quick distraction techniques just to help you sort of navigate away from those instant anxiety symptoms. So they will help you sort of certainly in the short term.
Perfect. Thank you so much. I will no doubt see you over the next couple of weeks.
Yeah.
All right. Thanks, Catherine. Take care.
Thank you. Bye-bye.